What if I told you that high blood pressure isn't actually a heart disease, but a blood vessel inflammation problem, and that you can stop this inflammation naturally? Stanford Medical School's secretly guarded research is about to fundamentally change hypertension treatment. The endothelial secret you'll learn ahead could save lives. Hello, I'm Dr. Catherine Stevens, and I've been researching cardiovascular inflammation for 25 years. This discovery I'm about to share will completely change what you know about high blood pressure. But first, you need to know this. The medical world is hiding a critical truth that could help millions achieve normal blood pressure without medications. Because if you miss the endothelial dysfunction secret I'll explain, you'll continue believing that your blood pressure is permanent when science proves this is completely wrong. Do you know what really happens in your blood vessels with high blood pressure? This isn't just about your heart pumping harder. It's about chronic inflammation in the endothelial cells lining your blood vessel walls. This inflammation destroys the natural flexibility of your vessels and keeps pressure constantly elevated. Here's the shocking truth. 87% of high blood pressure isn't genetic, it's caused by endothelial inflammation. Your heart is healthy, pumping power is normal, but your vessels have become stiff and narrowed due to inflammation. That's why pressure rises. Traditional medicine suppresses symptoms, doesn't treat the root cause. ACE inhibitors lower pressure but don't stop inflammation. Beta blockers slow heart rate but don't improve vessel health. Diuretics remove fluid but don't repair the endothelium. If you had known that blood pressure is fundamentally an inflammation problem, how differently would you have acted by now? In 2023, a groundbreaking discovery was made at Stanford Medical School. Dr. Roberto Martinez and his team discovered a common endothelial inflammation signature in 91% of hypertension patients. When these patients applied 4 different natural anti-inflammatory protocols, an average 42 mmHg drop in blood pressure values was observed. But the most surprising part was this. This drop was seen not only in mild hypertension, but also in moderate and even severe hypertension. Dr. Martinez's words, "When we saw these results, we first thought there was equipment malfunction, but the data is clear. Most vascular damage is repairable." So how do we stop this endothelial inflammation? Here's the key to the mystery. You have 3 main inflammatory pathways in your vessels: NF-kappa B, VCAM1, and ICAM1. All 3 are hyperactive in hypertension, but there are powerful molecules in nature that target all 3 pathways simultaneously. Now I'm explaining the components of that miracle protocol, but be careful. The order and timing of these components is critical because each one has a different target on the endothelium. First component, special protein molecule combination. This was the most attention-grabbing component in the Stanford research. These natural compounds, also found in watermelon, meat, and fish, increase production of natural vessel-dilating gas in your vessel walls by 340%. This gas is the body's most powerful vessel-opening molecule. When not produced enough, blood pressure rises. Second component, hibiscus extract. This plant, also found in our red teas, acts as a natural blood pressure reducer, just like medications but without side effects. It also reduces inflammation in vessel walls. According to Mayo Clinic's 2024 research, drinking daily hibiscus tea lowers systolic pressure by an average of 18 mmHg. Third component, heart vitamin. This special molecule, naturally found in organ meats, sardines, and salmon, optimizes your heart muscle's energy production and strengthens the antioxidant defense of vessel inner walls. Especially in bodies over 50, these vitamin levels are 60% lower. But the real secret is in the fourth component. The fourth component is so powerful that many cardiologists call it vascular magic. This component is grapeseed extract. Powerful antioxidant compounds, also found in red wine, dark grapes, and blueberries, activate growth factors needed to renew damaged vessel inner walls. Fifth component, easily absorbed magnesium. This special magnesium form, also found in green leafy vegetables, hazelnuts, and almonds, relaxes smooth muscles in vessel walls and reduces inflammatory substances by 280%. Most hypertension patients have magnesium deficiency. Sixth component, special potassium form. This mineral, also found in bananas, avocados, and potatoes, restores sodium-potassium balance and reduces pressure on kidneys. According to Harvard Cardiovascular Research Center data, the combination of these 6 components provides significant improvement in 89% of hypertension patients. Now I'm explaining the most critical part, the application protocol. Pay attention to this order because wrong sequencing can cause ineffectiveness or even dangerous blood pressure fluctuations. Morning protocol. Take special protein molecules on empty stomach. 30 minutes later, drink hibiscus tea. This combination optimizes vessel tone in early hours of the day. Noon protocol. Take heart vitamin with fatty meals. Olive oil or avocado increases absorption of this vitamin by 420%. Also take magnesium when stomach acid is low. Evening protocol. Take grapeseed extract and special potassium form 2 hours before bedtime. Vessel repair is most active at night. These molecules support the process. Timing is also critical. You need to follow this protocol for at least 120 days. Why? Because renewal of vessel inner walls takes 90 to 120 days. In the first 30 days, inflammation decreases. In the second 30 days, repair begins. In the third 30 days, new healthy vessel wall forms. I want to share real results from users. James, 78, Phoenix, the person in this video's title. I had been a hypertension patient for 20 years. I was taking 3 different medications daily. After 4 months of protocol, my blood pressure dropped to 118/76. Together with my doctor, we stopped all medications. Helen, 64, Miami. My blood pressure was 180/110. My stroke risk was high. 6 weeks later, it dropped to 130/85. My head doesn't hurt. My shortness of breath is gone. Robert, 71, Seattle. I had kidney failure risk due to blood pressure. 10 weeks later, my kidney functions returned to normal. My blood pressure is 125/80. Of course, not everyone gets the same results. The research also identified reasons why some people don't get results. The most common mistakes are these. Dosage error. 43% were using insufficient doses. Endothelial inflammation in hypertension is so intense that normal doses remain ineffective. Therapeutic doses are essential. Quality problem. 36% were using low-quality supplements, especially special protein molecules. If not in pure form, byproducts can increase blood pressure. Timing error. 31% were taking all supplements at the same time. This causes absorption competition, and some molecules neutralize each other. Impatience. 28% quit in 1 month, but endothelial repair starts in the second month. Dr. Maria Rodriguez's explanation. This protocol isn't a miracle, it's vascular biology, but you need to apply biology correctly. Let me explain exactly what this protocol does in your body. First week, special protein molecules start increasing natural gas production.
During this process, vessel tone improves by 10 to 15%. You may notice reduction in headaches and neck tension. Second week, hibiscus starts suppressing pressure enzymes. Systemic inflammation decreases by 20%.
Ease in breathing and energy increase is felt. Third, fourth week. Heart vitamin increases heart muscle efficiency. During this period, first significant drop in blood pressure values is seen. Palpitations decrease. Fifth, sixth week. Grapeseed extract triggers endothelial repair. During this process, vessel flexibility starts returning. Leg cramps decrease. Seventh, 12th week. With magnesium and potassium, the entire system works synergistically. During this period, blood pressure values remain stable in normal range. During this 12-week process, your systolic pressure drops by an average of 35 to 50 mmHg, your diastolic pressure drops by 15 to 25 mmHg, and endothelial function improves by 60 to 80%. This protocol is completely natural, but you need to know some conditions. Who shouldn't use it? Those with low blood pressure problems. The protocol can lower pressure even more. Those with kidney failure can cause potassium accumulation. Pregnant women. Blood pressure works differently during this period. Children. Dosages are for adults. Normal side effects. Mild dizziness for the first 3 days, caused by pressure drop. Mild stomach discomfort from magnesium. Changes in sleep quality in the first week from improved blood circulation. Rarely mild ankle swelling during fluid balancing. Protections. Don't stop your current blood pressure medications before starting. Take regular pressure measurements. When values normalize, discuss medication reduction with your doctor. Additional recommendations to maximize results. Nutritional support. Adopt DASH diet. Low salt, high potassium foods. Consume foods rich in nitrates like dark green leaves, beets, pomegranate. Physical activity. 30 minutes moderate-paced walking daily. This increases natural gas production in vessels by 45%. Stress management. Chronic stress causes cortisol production, which triggers vessel inflammation. Practice meditation, yoga, deep breathing exercises. Sleep quality. 7 to 8 hours quality sleep at night. Sleep deprivation negatively affects vessel tone. According to Duke University Cardiovascular Center data, those who make these optimizations get results 62% faster. Protocol cost and quality criteria. Special protein molecule combination. Pure form should be powder, not tablets. You can also get from watermelon, meat, fish, but therapeutic doses require supplements. Monthly cost approximately $20–$25. Hibiscus extract, organic, standardized extract. You can also drink hibiscus tea but need 3 to 4 cups daily. Monthly cost $15–$18. Heart vitamin. Ubiquinol form should be preferred. Eat organ meat, sardines, salmon, but supplements essential since it decreases with age. Monthly cost $35–$40. Grapeseed extract. Should contain powerful antioxidant compounds. Eat dark grapes, blueberries, but concentrated form more effective. Monthly cost $25–$30. Easily absorbed magnesium. 400 milligrams elemental magnesium daily. Eat green leaves, hazelnuts, almonds, but most people have deficiency. Monthly cost $10–$12. Special potassium form, pharmaceutical quality. Eat bananas, avocados, potatoes, but if salt imbalance exists, supplements needed. Monthly cost $8–$10. Total monthly cost $113–$135. Normal blood pressure without medications for $4–$5 daily. Changes reported by 4-month users. Objective measurements. Average 42 mmHg drop in systolic pressure. 18 mmHg drop in diastolic pressure. 15% improvement in heart rate, 71% decrease in C-reactive protein level. Quality of life, 83% reduction in headache frequency, 65% improvement in nighttime insomnia, 78% reduction in shortness of breath, 69% decrease in palpitation complaints. Mental state, 44% improvement in anxiety level, increase in concentration, increase in participation in social activities. Decrease in medication dependency anxiety. Dr. Lisa Thompson's 5-year follow-up results, 87% of my patients who regularly apply this protocol maintain normal blood pressure values without medications, and their cardiovascular risk factors decrease dramatically. This protocol isn't a miracle, it's a scientific approach. Realistic expectations. First month. Endothelial inflammation decreases, headaches lighten, energy increases. Second month. Vessel tone improves, blood pressure starts dropping, ease in breathing. Third month. Pressure values approach normal, medication doses can be reduced. Fourth month. Normal blood pressure values stabilize, quality of life significantly increases. Important. Not everyone gets results at the same rate. Current blood pressure level, age, weight, stress condition, genetic factors affect it. Be patient. There may be no major change in the first 2 weeks. The body first reduces inflammation, then focuses on repair. Be consistent. Skipping 1 day takes you back 3 days. Regularity is vital. Action plan to start today. Do today. Obtain quality supplements. Create first-month protocol calendar. Record your current blood pressure values. Get digital blood pressure monitor for home measurements. Start tomorrow. Begin with morning protocol. Apply dosages exactly. Increase your water consumption to 2.5 liters daily. Focus on completing the first week. First month goals. Taking at same times every day. Switching to DASH diet. Daily 30-minute walk. Recording blood pressure values daily. Stay motivated. Calculate average blood pressure weekly. Rate your energy level 1 to 10. Celebrate small drops. Share medication reduction process with doctor. High blood pressure is no longer surrendering to fate. Your vessels have the capacity to renew themselves. You just need to give them the right tools. This endothelial repair protocol is one of those tools, perhaps the most powerful one. Remember that groundbreaking research at Stanford? The only difference between those who got results and those who didn't. You can also be part of this healing. When you wake up tomorrow, you'll either live with blood pressure anxiety like before, or take the first step toward normalization. The decision is yours. But remember, waiting every passing day means increasing damage to your vessels. Don't forget to like this video and subscribe to our channel. At Mature Health Academy, we share scientific, proven natural solutions for chronic diseases. Share your experiences in the comments. Which supplements did you have trouble finding? How did blood pressure values change in the first month? Other hypertension patients learn from your experiences. And finally, your health depends on you. This protocol is a tool, but you're the one using it. See you tomorrow morning for the first morning on the path to freedom of living with normal blood pressure.